Hi, my name is Fernando Segovia. I work at Cross-County Cardiology as a vein specialist as well as a cardiologist. And today we're going to be talking about vein care. How do patients benefit in 2024 with minimally invasive procedures is the question. The modalities of treatment vary depending on the cause of the patient problem. There will be different treatment depending on the size of the vein, tortuosity of the vein, perforators, which can at some point complicate some of the procedures if they're not taken care of properly. Now, the modality of treatment will include thermal ablation, chemical ablation, or mechanical thermal ablation. There's also procedures where there's only injection of the chemical. It is already manufactured for that purpose, like Varithena, which is a medication on a form of foam. There's thermal ablation with a laser catheter or radiofrequency catheter. Those are the main two modalities. And they've been available, since the year 1999 for laser and 2001 for radiofrequency ablation. Leg swelling is a very common symptom. Many times is related to vein disease or vein flow abnormalities, which can be affected by weight. The weight of the patient can also produce a decreased venous flow because of compression in the abdominal and pelvic area. There are other forms of mechanical compression can happen as well because of the anatomy of the patient, and those are treated differently. That's usually the main goal of treatment. Dietary component of the vein treatment will be focused on basically keeping a healthy weight. As we mentioned before, the larger the weight, the more venous stasis it will be, and leg swelling. And is a very common pattern in patients that are significantly overweight. Compression shock is one of the mainstays of insufficiency treatment, and it's got to be understood by the patient that it's important for them to adhere to these kind of devices. Obviously, they're uncomfortable many times, but they're very, very beneficial. It is important to know that there are patients that don't want to use them and they want to go for the minimally invasive procedures. They have to understand that they will have to use them if they want an optimal result of the procedure that was administered. And many times I recommend the patients not to use them just for the period of time that is advised by the literature. I tell them, try to use them all the time when the weather allows it, when it's not too hot. 30 million Americans suffer from vein disease. Symptoms sometimes are so gradual that patients don't even notice them. And it's not until they come to the doctor and they have some swelling of the legs. When they notice this after they get treated, they realize how bad their legs were.